Final preparations before surgery. Dr. Mukhalad Saud marks the areas where he plans to make incisions. This patient from Yemen is suffering pain from burn scars left behind from a bomb attack. The plastic surgeons and orthopedic doctors in this special clinic treat long-term complications resulting from war injuries. This patient has burn wounds on his arms and back. It's difficult for him to move his arms. I'll try to give him some movement back. For Shadi, it's all he can hope for. I hope the operation will go well and I'll be able to live a normal life again. But first of all, Dr. Mukhalad and his team have to deal with a wounded child from Syria. There's little prospect of undergoing these highly specialized operations where the patients come from. Here, surgery is free of charge. We take in patients from Yemen, Iraq, Syria, and sometimes Palestine and Libya. They often have severe war wounds, which later develop complications. The surgeon is confronted with the horrors of war in the Middle East on a daily basis. Dr. Mukhalad comes from Iraq. He's deeply affected by the fate of his patients. I have to separate my emotions from my work in order to help these people. We empathize with them outside of the surgery room. They all have tragic stories. Imagine a bomb or a fire suddenly turning a perfectly healthy person into someone with disabilities. The young man from Yemen is out of surgery. Most of the patients have to undergo lengthy rehabilitation therapy. The clinic offers this also, but the waiting list is long. Mouryad from Syria is learning to walk again. The 26-year-old has already had 3 operations and has been coming to the rehabilitation clinic for 7 months. First, I'm learning to walk. I'm not thinking too much about what comes after that. I'm doing it bit by bit. Mouryad needs a lot of willpower and support from the therapists. They also offer their patients psychological support. The doctors also recognize the need for psychological support in the recovery from injury. We're dealing with 2 things. We're not only aiming to heal superficial wounds, but also the wounds on their soul. Shadi's operation went well. He can move his arms better. The doctors now have to deal with their next patient. The conflicts in the region won't let them rest.